All right. Good morning, everyone. We'll call this Grey County Long-Term Care Committee of Management meeting to order. Welcome, everyone. Just to remind the elected members of your obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have no delegations this morning. Our first report is LTCR CM 1023, the long-term care director's update. Have a motion that report LTCR CM 1023 regarding the long-term care director update be received for information. Can I have a mover to get that on the floor, please? Moved by Councillor Nielsen and seconded by Councillor Keaveney. And Karen, thank you for your email this morning to keep me in order. So I'll turn this over to you in Jennifer's absence. Morning.
Good morning and thank you, Mr. Chair, and good morning, committee members. Wow, yeah, when I was reviewing this morning to present today, you don't realize how much happens in a few short weeks in long-term care till you write it all down on a piece of paper. So bear with me and we'll move through the report this morning. Back in March, the Chief Medical Officer of Health announced that Ontario was taking a phased-in approach in updating the COVID-19 measures for people living in, working in, or visiting long-term care homes. With the high vaccine intake among residents and the availability of safe and effective antivirals, this is reducing the risk of severe outcomes to residents, which in turn allows for certain guidance to be phased out in Ontario. And we received a memo outlining what those changes would be. So these changes came into effect back on March 31st already. Asymptomatic screening, the rapid antigen testing, was phased out. We were doing this testing for everyone entering the home on a daily basis, but we have phased that out. Each home did leave one station set up in case visitors or staff just wanted to do that double check before coming in. But we're, in all honesty, not seeing a lot of people taking that opportunity. Outdoor masking removed. The recommendation for outdoor masking was removed. We are still required to wear masks indoors, though, at all times for staff, caregivers, and general visitors. If a visitor is in a resident's room with just their resident, they may remove their mask at that time. We were completing daily temperature checks on residents, and those have ceased. We do, however, continue to monitor the resident status at all times. If a resident goes out on an absence, they are no longer required to actively screen upon returning to the home or test or isolate. Active screening has subsided, but instead we continue to passively screen. So each of the homes has a list of questions for staff and visitors to ask themselves before entering. And the basic message is please don't come if you're not feeling well. If we are in an outbreak, there is still some limits to visitors at that time. So one caregiver at a time during a COVID-19 outbreak, if the resident is symptomatic or isolating. And during an outbreak, we are subject to public health direction regarding this guidance related to visitors. We are now able to hold activities without adjusting to optimize for physical distancing. So that was very exciting for the residents. We were required to submit daily COVID-19 outbreak data to the ministry, and that requirement has been lifted, but we are still required, as we always were, to report confirmed outbreaks using the critical incident system. Also on March 24th, Ontario Health released a memo to inform health system partners that the Ontario Assessment Centres would be winding down as of June 30th, with a small number remaining operational for areas that have limited access of testing. So they're winding down testing across the province. Jennifer and Dana actually did host a virtual family meeting on April 5th to update families related to these guidelines. As far as infection prevention and control, the IPAC and wellness leads at each home are collaboratively working on standardizing IPAC posters and communications and exploring options for electronic auditing through the SOAR application. In addition to daily surveillance and outbreak preparedness and management activities, the leads are assessing current program practices to identify areas for enhancement and to ensure compliance with the new IPAC standards that were released with the Fixing Long-Term Care Homes Act. We had a number of funding announcements during the period, so we'll go through each of those. As part of the government's plan to fix long-term care, the Ministry of Long-Term Care released a memo on March 9th, confirming their continued commitment of $4.9 billion over 4 years to increase the average daily direct care to 4 hours per resident by the end of March in 2025. This process is not new. We started this a couple of years ago. The province has overall reached its goal of 3 hours for the most recent fiscal year that ended in March. And our homes have budgeted to meet the 3 hours and 42-minute level coming up in the current budget year. So those are direct care hours, including nursing, PSWs, RPNs, and RNs. We also will continue to receive $10 million annual Supporting Professional Growth Fund money. And the purpose of this funding is to support training and education of staff. We also received a memo confirming the permanent personal support worker wage enhancement. That's the $3 that was announced temporarily early on in COVID, but became permanent about a year or so ago. So that it will continue. We also received information related to our case mix index. This is the funding methodology that the ministry uses to determine funding for the homes in the nursing and personal care envelope. And you can see that our case mix index numbers are listed there at the bottom of page 3. And just on the chart on the next page indicates the result in dollars that the CMI changes reflect. You can see Lee Manor went down about the same amount that Grey Gables went up, and Rockwood Terrace also went down slightly. So overall, there's a negative $17,000 to the 3 county homes. The ministry also released funding related to the clinical decision support tools and infection prevention and control personnel. And we were happy to note a 2.4% increase in the level of care base funding. We had budgeted 1.5%, so this was a great news story for us. And the results of that funding are listed just over at the top of page 5 there, actually, what that changed from what we were budgeted in to what we actually received, a difference of almost $105,000. Also included is a chart of the monies that we're receiving per diem for the new fiscal year per resident. Top-up funding for annual staff supplement and behavioral specialized unit beds are also included in the home's level of care per diem funding summary. They combined 2 or 3 minor capital programs. We were receiving an IPAC minor capital, a long-term care minor capital, and some money for falls prevention equipment. And they have combined those now all into one funding pot called Comprehensive Long-Term Care Minor Capital Program. And these are used to purchase things like fall prevention equipment, minor capital items that help with infection prevention and control, There is a list of things that qualify, but it's pretty fairly broad. So we're able to use this funding for various things around the home. Also is available is a local priorities fund. And this supports Ontario Health working in conjunction with the Home and Community Care Support Services and long-term care homes to make tailored and targeted investments in specialized staffing, equipment, and services to support placement of patients from hospitals, ALC beds into long-term care. And we were fortunate, we applied for this funding and opened and received temporary licenses for 1 extra bed at Lee Manor and 2 extra beds at Rockwood Terrace. So Rockwood Terrace is operating at 102 beds and Lee Manor 151 currently to help relieve the pressures in the hospital system. We continue to actively recruit in all nursing areas and food service workers. As summer approaches, we welcome back team members who have been on educational leave and also some new summer students who are joining the 3 long-term care homes. On April 28th, the 3 homes' entire leadership teams, as well as some support folks from the county building, attended a leadership session focused on equity, diversity, inclusion, and belonging. This was a great day. We had a really great speaker, T. Garnett, who is a Sick Kids executive lead and strategic advisor, come and spoke to us for the morning and supported a cafe style question and answer period for the afternoon. We also were joined by Joan Beecroft and Charmaine Peaver from Grey Bruce Seniors Pride Group. And I'm sorry, I'm going to wreck her name, probably Deepika Gupta from Grey Bruce Local Immigration Partnership. So it was great to have them there supporting our day as well. And we look forward to implementing some positive changes that aligns with our Color It culture to ensure everyone feels welcomed, valued, safe, and respected in our care communities. The 4th quarter wellness newsletter was released at the end of March in all 3 care communities. And the wellness newsletter promotes our EAP program, as well as wellness tips and resources, some healthy active living tips, and usually a recipe or 2 to enjoy, and also some photos of some things going on among the homes. I think Renata is going to talk about accreditation a little bit later, but we are working through the Accreditation Canada self-assessments. Currently, the staff at all 3 homes are completing a work-life survey and resident culture survey through our Surge Learning platform. So that will be good to collect that data. And all of this will be in an effort to create an action plan, hopefully by the fall, so that we're ready for accreditation. There was a phase 2 update to the Fixing Long-Term Care Act announced on April 6th, which came into effect on April 11th. Yes, 5 days later. A lot of changes were made to staffing qualifications, and I'm not going to go through each one of them, but they are all listed there for your review. The transitional staffing qualifications, the provision is extended to October 11th. However, the person in the position must have the adequate skills, training, knowledge to perform the duties required of that position. This was for during COVID, some of the rules were relaxed a little bit. I think our 3 care communities continue to hold the line. So I don't think we have anybody that falls into this situation that we would be looking to terminate. There were also some updates on air conditioning. And again, our 3 care communities are in good shape regarding air conditioning in the homes. Changes related to medication management, clarify medication safety processes and embedded practices in medication administration. in regulation to better respond to current needs, trends, and emergency situations, enhancing medication safety for residents, and included those updates related to glucagon, the 24-hour admission care plan, and the medication plan of care. Changes have been made in the regulation to update requirements to better respond to current needs, trends, and emerging situations regarding resident experience. And these include clarifying when an alternative level of care patient is eligible for admission to preferred accommodation, paying the basic accommodation rate, and when a licensee may request a resident to sign a preferred accommodation agreement. It also expanded the eligibility for the temporary admission into preferred accommodations. There was an update to the Falls Prevention and Management Program to strengthen post-fall assessments, and clarification on when a registered dietitian must conduct skin and wound care assessments. There was also revised wording to clarify the role and accountability of medical directors. And the new update ensures nursing students from all approved Ontario post-secondary nursing programs can administer medication under defined conditions by capturing Indigenous institutes in the definition. Under partnerships, we continue to work with the Grey Bruce Long-Term Care Committee, and our healthcare partners continue to meet regularly. We had some really great news in April with the YMCA Employment Services announced that funding for the personal support worker training was approved through the Ministry of Labor. Immigration Training and Skills Development Program. This training was introduced to our current staff in our 19 long-term care homes who were interested in transitioning to the PSW role, and then it was also extended to the public. There are 38 students that will be participating in this fully funded program, and all 3 of our Grey County care communities have students in that program. And since that time, they've opened up or announced a full-time program as well, so that's very exciting. This month, all 3 homes will be participating in the York University research study, Counting What Counts, and this study assesses quality of life and its social determinants among long-term care residents with dementia. The study assesses the quality of life of long-term care residents, as well as the important resident and facility characteristics that may influence a resident's quality of life, such as residents' health, social support, or financial situation, and a facility's size, ownership, or quality of care provided. The main benefit of the study will be determining strategies to improve quality of life and disparities in quality of life for long-term care residents with dementia. It will be an important first step to prepare for intervention studies aiming to improve quality of life and disparities for long-term care residents as we move forward. On April 5th, the Ontario Health, along with the Ontario Caregivers Organization, held an information session for health system partners that focused on the Essential Care Partners program. Jennifer was a guest speaker and presented an overview of our designated care partner program and described the valued partnerships that plays a crucial role in person-centered care. And we continue to be thankful for the support we receive from council, the CAO, senior management team, and the staff in all departments. We recognize that we are in this together as we color it for our residents, families, staff, and communities. And there were a number of attachments there to as a follow-up or resource for the report. And I'm happy to take any questions.
Thanks very much, Karen. That was a lot of information. So we'll look to questions, and you did a very good job in Jennifer's absence. So thank you.
Thank you.
Questions from committee members, and welcome Councillor Hutchinson and Councillor Carlton. We saw you sneak in there. Questions from committee members. Warden Millen, go ahead.
Thank you, Mr. Chair. Thank you, Karen, for that report, and you're absolutely right. There was a lot of information there. Two questions. The first one, regarding staff vacancies. Are we still using agency staff? And if we, and I expect we do have, vacancies, various staff, how are we coping with that? And, the other question was regarding the accreditation process. Is there a role for governance in that process, or is it strictly, operations? Please.
Thank you, and through you, Mr. Chair. I'll maybe talk about staffing at Rockwood, and then maybe Stacy and Shannon can talk about their respective homes, and then we'll turn the accreditation question over to Renata. So we do continue to use agency mostly for PSW here at Rockwood, a couple shifts of RPN. Fortunately, we have not had to use them for RN, so that's good. Our personal situation is looking better related to staffing. So we're helpful or glad for that. Melanie, our HR business partner, has returned from maternity leave, and she has been very helpful in getting people onboarded and interviews happening. We still continue to use the care support assistants to help in the home areas, especially if we are short PSWs. But things are definitely looking brighter than they were a year ago for us here at Rockwood. Shannon?
Perfect, thank you. Yes, we also use agency staff here, but mostly ours is for the RN. We do have a good number of resumes and applicants for the RPN position, so we have been doing well with that. We have 4 vacant lines right now for our PSWs, but the resumes have been coming in, so it's definitely looking a lot better now as well. So we're doing well here. Seems to be right now, knock on wood for the summer anyways, but, and I'll pass it over to Stacy.
Stacy.
Thank you. Through you, Mr. Chair. Yes, I can also share a quick update on our staffing. We're actually doing quite well. I would say that our staffing is stable. I'm very happy to report that actually at the end of this week, we will have onboarded 14 to 15 new PSWs, which will be very, offer a great level of support through the summer. We too also use agency, not on a routine basis, but when we are seeing some highs and lows with staffing, they've been able to fill the void with PSWs primarily as well. And again, our HR business partners have been wonderful to work with in that ongoing recruitment process. So we've been really able to take advantage of the students or people who are in the RPN program and then are able to be qualified to work as the PSW students for the summer. So that's really helping us out.
Thank you very much.
And I think Renata was going to speak to the accreditation part.
Yes, good morning. Yes, there is a role for governance in the accreditation process. There is a section of standards on governance, and we will be bringing those forward. In the next cycle of accreditation, you will be doing a governance survey. At the moment, we're working through the self-assessment tool. Governance is on oversight and quality improvement oversight for the homes in general.
Thank you.
Councillor Patterson, morning.
Thank you, Mr. Chair, and good morning, everyone. Thanks, Karen, for the report. Very well done. I have 3 questions. They're not that, it's more information for me. The virtual family meeting, is that one for all 3 homes, or does each home hold it? And what's the participation like, the attendance?
Through you, Mr. Chair, it is one meeting for all 3 homes. And I don't know, Dana might know better I know in the heat of COVID, they were really well attended. I think it has been waning a little bit lately, but Dana, do you know how many were on the line the last time?
Certainly. If I can recall, and through you, Mr. Chair, if I can recall, I think we were looking in the 40s. But yes, Karen is right. At the peak of COVID, we were having a significant number. We also work with our communications group and Olivia and Rob to ensure that we record it, and then we send out a follow-up email. So if people don't attend the live town hall, it is shared the very next day with any attachments or questions that have come. We respond to that, and that goes to a very wide selection. I'd have to double check the number that gets our recording, but we also hear some follow-up questions as a result of the town hall that's been recorded.
Thank you. That's very good. Excellent that it's going out. The recording is going out to everyone. My second question is the CMI funding. So I don't know a lot about that. Is it determined annually? And what happens if the numbers increase, like you said, at Rockwood and Lee Manor? Does the CMI funding increase during this year or not?
Through
Who
you,
wants that
Mr.
one?
Chair. Well, I'll take a stab at it, and then anybody can join in if they have some more to add. The CMI funding is based on the RIE assessments of residents. Unfortunately, the data is about a year old, so it looks at our resident base from about a year ago and assigns funding based on that RIE data. Having said that, the pie is only so big, so it's still the same amount of dollars that are being sliced between the homes. So if we look back at the data we received, Lee Manor and Rockwood Terrace, our CMI numbers actually dropped a bit, while Grey Gables increased. So again, that's based on resident assessments from about a year ago. I don't know, did that answer your question, or maybe does somebody have anything that they wanted to add? I think.
I see Kim's hand. You're on mute, Kim.
There. Good morning, everyone, and excellent question, Councillor Patterson. The CMI has been sometimes compared to what used to be CRF or OMPF funding. If you can recall some of the discussions around that, we're sure there's a formula somewhere, but whether or not we're actually allowed to know it is another question. So an awful lot of effort is put in at the homes to ensure that our documentation is as complete and correct as it can be, in order to try to do our very best to show the true nature of the situation. But it's something that there's been an awful lot of conversation about over the year, about whether or not this was the most appropriate way to provide these resources. In fact, if I stand to be corrected, but I believe they were going to step away from this and change to a different funding model. And then that didn't happen this time, but it may in the future.
Thank you. And if I may, Mr. Chair, my final question, and
Absolutely.
this one shows my lack of knowledge. You mentioned registered dietitians must conduct skin and wound care assessments. How does the dietitian, like I would think it would be a nurse, so how does the dietitian fit into that?
Thank you, through you, Mr. Chair. The registered dietitian would be assessing the residents' nutritional intake to see if there's some increases that can be made there, either with a supplement or sometimes it's protein powder, to increase their protein intake to help with healing of the wound. So they're not really assessing the wound itself, but assessing the residents' nutritional status to try and improve it to promote healing.
Very good. Thank you.
You're welcome.
Other questions from committee members? Just one follow-up question from the chair in regards to the case mix index. Does the behavioral support unit at Grey Gables increase that case mix index, or does it have any bearing on it whatsoever?
Thank you.
Not
I'll
sure.
maybe let Shannon take that one if I could, because
Okay.
I'm honestly not sure.
Thanks. Shannon?
And to be honest, I'm not 100% sure either. I do know that it will affect it, like, because all residents are assessed by our RI. But it wouldn't have had the effect for this year, this CMI. So we'll probably see it for next year.
All right. Because we've got increased staffing in that unit, correct? Because of the behavior. So you would think it would have some impact on the case mix index, but
Well, the case, through you, Mr. Chair.
yes.
The case mix index is the assessment of the residents. So we do have the extra funding for the staffing in there.
Right.
But it would be the residents and their assessment at the time.
And my only other question was in regards to the increased hours. Does the provincial funding cover all the cost for the increased hours? Or does the county need to help contribute with that?
Thank you.
Karen?
And through you, Mr. Chair, and Marcus can correct me if I'm wrong. To date, what we found is that the funding is covering. We were already staffing slightly higher, I would say, than some homes in the province. So we kind of had a leg up. And what we're finding is that so far the funding is covering those increases that we are able to make.
Thank you very much. All right, last chance for questions on this report. Not seeing any. I'll call the question. All in favor of receiving it? That is carried. Thank you. We now have get back to my agenda. We have LTCR CM 1123, the long-term care operational report from February 15th to April 14th, 2023. Can I have someone to move that report LTCR CM 1123 regarding the long-term care operational report from February 15th to April 14th, 2023 be received for information? Mover, please. Moved by Councillor Patterson and second by Councillor Hutchinson. I believe Renata is going to speak first on this report. Renata, we'll turn it over to you.
Thank you. And through you, Mr. Chair, the quality indicators, the Canadian Institute for Healthcare Information released the third quarter data in March. The homes continue to make improvements in several areas, but as you can see, the residents receiving antipsychotics without a diagnosis data increased above the provincial average. The increase reflects the care needs of the residents recently admitted to the homes, including residents admitted to the behavioral unit at Grey Gables. The interdisciplinary teams are focusing on interventions to assist the residents with managing their behaviors that do not involve antipsychotics where able. The clinical and quality specialists continue to support their teams in their quality improvement projects. The quality improvement plans for 23-24 have been developed and posted both to Health Quality Ontario and on the county's website, along with being posted in the homes. The quality objectives that are set out by Health Quality Ontario continue to include number of emergency department visits, the percentage of residents responding positively to what number would you rate how well staff listened to you, and can you express your opinion without fear of consequences, and the percentage of residents taking antipsychotic medication. The teams in the homes have developed improvement initiatives to meet or exceed the established benchmarks. And attached to the report are the 3 quality improvement plans for each of the homes. Accreditation. We are well on our way to preparing for accreditation. These last few months, we have been working on the self-assessment, and the county homes have partnered with Accreditation Canada to achieve accreditation status by May 2024. It is through the long-term care Cumentum program, which is specifically designed for long-term care. And the standards will help us assess ourselves for our home strengths and our areas for improvement. The next 13 months we will be continuing to prepare along with the workforce surveys that were mentioned in the earlier report and the quality improvement plans. Attached is a document that outlines the steps that we'll be taking to achieve accreditation status. Are there any questions?
Thanks, Renata. Questions on Renata's report? Must have covered it all off, Renata. Thank you.
Thank you.
We'll now go
You,
to,
Mr. Chair, I apologize for the interruption. Councillor Keaveney had her hand raised.
well, thanks, Sarah, for Councillor Keaveney, go ahead.
Hi, thanks very much, Mr. Chair. I may be ahead of myself. I wanted to ask a question about depression felt amongst patients. Would this be the time, or do you wish me to wait until the next section of the report?
No, the question's already asked, so let's get the answer.
So let's go for it. I noticed that the average rates are higher in 2 of our homes than the provincial average. And I'm just wondering if we think with additional hours of care and with the amazing programming and with being post-COVID now, if we think those rates will improve.
Renata?
Thank you through you, Mr. Chair. I believe that there are a lot of factors that lead to depression amongst our residents. I do believe that I hope that the increased hours and the increased care provided and supports provided will help our residents with depression, along one-to-one care, a little bit more time with the residents by the increased hours. Definitely our programming has changed and now people are socializing, and that will certainly provide a benefit to the residents. This data is from the end of last year, and in a few months the next set of indicators will be released, and hopefully we'll see an improvement in the residents' moods and depression.
Okay, Shirley? All right, any other questions before we go on? Not seeing anything. We'll turn it over to Dana now to talk about the medical officers' reports, or medical directors' reports, sorry.
That's right.
Go ahead.
No, that's okay. Good morning, and through you, Mr. Chair, I'm pleased to share a summary of our medical directors' annual reports for 2022. And before I get into the annual reports, I want to flag, as Karen already gave you a bit of a heads up, that we did have some changes for our medical directors because of the Fixing Long-Term Care Home Act. Our medical directors are now required to complete the Ontario Long-Term Care Clinicians Medical Directors course and also attend on site for a minimum number of hours. So we're working through that, and beyond what they already do with oversight of residents' clinical care in the home, these on-site hours are specific to what we call their administrative responsibilities and duties as medical directors, including working on supporting clinical policies and procedures, supporting us with medical directives, working with any attending physicians to ensure we're meeting the standard, and participating on required interdisciplinary committees and quality improvement activities. And we're really thrilled to be able to have such actively engaged medical directors in our community. For Grey Gables, Dr. Brian Power is our medical director. Dr. Cornelius Van Zyl provides medical direction at Lee Manor, and Dr. Mary Pillish is Rockwood's medical director. You have the full reports attached in your package, but I just want to briefly summarize the highlights and challenges identified in 2022. So one of the things all medical directors found a difference, and I think this goes to Councillor Keaveney's question, is that there was reduced social isolation for residents, more family members, and we're hoping as a result of loosening those provincial restrictions, and we're certainly hoping that that will support our residents and their well-being. And we all felt that it was very difficult with residents and their well-being. With high levels of vaccination was also a key highlight, and the introduction of antiviral supported the direction of reducing restrictions. And our medical directors, we certainly advocated the province for the ability to crush Paxlovid, and that was also a really supportive initiative, and now we can utilize that antivirals. The Grey Bruce Behavioral Support Transition Unit was really identified as a supportive highlight from our medical directors, and the fact that they had mobile x-rays secured in-house. So increasing diagnostics is really supportive for our medical directives in order to do some early identification and treatment, and residents don't have to go off-site. So we're working on building some more on-site diagnostics. Some of the challenges that they flagged, and we all had back in 2022, was the human health resources, and not only with direct frontline, but also with covering physicians. The commitment of our community, our medical directors, because they also provide service in the community. It's that is a challenge to find covering physicians with all the things that go on in our long-term care community, as well as the progressing acuity of healthcare needs for residents moving into long-term care. That was certainly flagged as a highlight. And you'll, again, with the local priorities funding needing to support, situations we may not have seen in the past in long-term care. Our outbreaks have been noted as both a challenge and a strength. Challenges because the introduction of new respiratory agents back in 2022, when we were so focused on COVID, and that seemed to be the only circulating agent. And now things, as I look at the current outbreaks that we have in our community, human metapneumovirus, rhinovirus, in addition to COVID, but as measures loosen in the broader community, that's where more agents can come in. So when you're dealing with two agents, in some of our outbreaks in 2022, that was a challenge. But the strength was the ability to take a measured approach to outbreak management based on the strength of our high vaccine rates, sound infection control practices, and the completion of risk assessment to reduce any unnecessary social isolation. So it is a balancing act that we've been working on. And looking from terms of our medical direction, looking into 2023, we'll be working with the medical directors on two primary project areas, aligning the new palliative care approach with the Ontario Provincial Framework for Palliative Care. And that's one that it's our theme for 2023, as well as using the use of technology with our new physician engagement tool and secure conversation modules with our EMR and electronic medical record, so they can access charts on the go securely and communicate with our staff even when they're not in-house. So over to you, and if there's any questions.
Thanks, Dana. Questions for Dana? Dana, I had one question, and it's in regards to the role of the medical director and the family physician. When someone moves into long-term care, does the family physician, is their role eliminated, or do they continue on? And what is the connection, I guess, with the medical director?
Yeah, I think, and that is part of the conversation with new residents moving in, to ask where they have the ability to continue with their family physician, or if they choose to transfer care to the medical director. And in one of our communities, often the majority of our residents are already with the medical director in the Markdale area. But in Owen Sound, many residents choose to transfer care. If the family physician does continue, they are part of the attending physician, and there's a process to sign on. And the medical director supports those attending physicians to ensure that they they're aware of our policies and procedures and oversight of care. But I would suggest, and I'm looking to the EDs, but the majority do transition to our medical director. It is more comprehensive care. The medical director is on site, and that transition is formalized it definitely delivers a good client-centered care approach.
Thank you very much for that. Any other questions for Dana? All right, I think we'll go to Stacy. Morning, Stacy.
Good morning. Through you, Mr. Chair, I'm going to provide an update on the outbreaks. So all 3 care communities experienced respiratory outbreaks during the reporting period. Rockwood Terrace had 1 home area that was impacted and affected 20 residents. Grey Gables experienced 2 respiratory outbreaks in different home areas and affected 12 residents in total. And at Lee Manor, 4 home areas experienced outbreaks where a total of 30 residents were affected. At this time, I'd also like to acknowledge the outbreak status at Lee Manor. We are currently managing confirmed COVID outbreaks in 3 home areas. And over the weekend, we expanded to a suspect COVID outbreak in another. In response, we've enhanced our monitoring for new symptoms in all residents and staff. We strategically placed HEPA filters throughout the home. We've increased our IPAC and hand hygiene audits and are enlisting hands-on support of our sister home, IPAC Leads to assist. As an additional precaution, we've also moved to having all staff and visitors wearing N95 masks and eye protection in all home areas. Our medical director has also been on site to assess and follow up with resident care. Affected residents generally are doing well, and we're monitoring their status very closely. However, we are saddened to report that we have had 1 COVID death, and our condolences go out to the family. Our situation continues to evolve daily, but we are managing stable staffing patterns and have contingency plans for consideration if our situation changes. And as I shared earlier with onboarding 14 to 15 new PSWs by the end of the week, that will be a wonderful support in this situation. And as with any outbreak in our care communities, we work very closely with our partners at Public Health. And since adding IPAC and wellness leads in each home, we now have additional expertise, knowledge, and skills to help us manage and contain these situations. We're very grateful to have their expertise to support the safety and wellness of our residents and staff and visitors. And I'm happy to share that our public health partners were in yesterday on site to conduct an IPAC audit, and there were no gaps identified.
Thanks very much, Stacy.
You're welcome.
Questions for Stacy? Not seeing any. I think it's back to Karen now.
Yes, thank you, Mr. Chair. I just wanted to highlight the occupancy chart that's in the report there on page 19. Our occupancy at Rockwood Terrace is lower than we would like it to be currently, and there are a number of reasons for that. As some of you are aware, if we are in an outbreak situation, we are unable to admit to the affected area during that time. So that kind of slows things up a little bit. With the opening of the new beds in Owen Sound, we're seeing a lot of movement with the wait lists. And sometimes when we were offering beds, the resident had received 3 bed offers at the same time. So that also delays things while they choose which home they're going to, and then we can move on, which also allows us to move through our wait lists sometimes fairly quickly, and then sometimes we're waiting for updates for residents who maybe they didn't expect that we would get to during that time, but here we are, and we're waiting on an update. We've been feverishly admitting residents, so I'm pleased to report as of today, actually, we're up to 100 out of 102. We took some opportunity to do some room refurbishments at the same time. So we are doing that right now again for another room, and hope to be at 102 next week. Grey Gables had similar situations with outbreaks and not being able to admit. They find the same thing with the wait lists and getting updates and people getting several bed offers at the same time, and are also with the BSTU causes some increased issues with admitting too, but we're both on the way up, and I just wanted to highlight that. I'm also just going to talk about health system partners. So during the reporting period, Public Health visited all 3 homes to inspect the main kitchen. Grey Gables and Lee Manor had no findings related to that. Unfortunately, here at Rockwood Terrace, we had 3 areas of non-compliance, and all have been corrected since the visit. Lee Manor also.
Sorry, Karen,
Yes.
could you just speak what the non-compliance issues were?
So one was related to a piece of baseboard missing in the food storage area. One was related to a spill she found that hadn't been there very long, but regardless, she found a spill, and that was the second one. And the third one was related to our exhaust hood over the cooking equipment, the stoves. Was dirty, so that has since been cleaned, and a plan in place to have that cleaned on a regular basis, so it's not an ongoing issue.
Thank you.
You're welcome. Troy Fire and Safety were also at Lee Manor and completed their annual inspection of the fire safety plan. There was one item of deficiency, and that has since been corrected. And that's all for me, unless there are any questions.
All right. Any questions from committee members? Warden Mellon, go ahead.
Okay, my computer just did something funny there for a second, but anyway, we're back. Regarding the inspection from the health unit and the hood over the cooking surfaces being dirty, would something like that, would that be communicated to the other 2 homes so that, you know, they're heads up and that they can also get a plan in place? I mean, quite frankly, I'm a little surprised that there wasn't a plan already in place to clean it on a regular basis. Maybe it wasn't regular enough for the inspector, I don't know, but could you just speak a little more to that particular issue, please?
We do share our reports. Sorry, Mr. Chair, through you. We do share our reports with each other so that changes can be identified if necessary in the other homes. And yeah, I think with the range hood, it had been missed in its regular cleaning. So we're just reinforcing the importance of that on a go forward.
Most excellent. Thank you very much.
Any other questions? All right, we'll move on to Shannon. Morning.
Good morning. Through you, Mr. Chair. During this reporting period, the staff have had lots of color-it moments with the residents, and the residents have enjoyed plenty of special occasions and entertainment. The Easter Bunny was able to make his rounds to all 3 homes. Pancake Tuesday was celebrated with made-to-order pancakes, Mardi Gras music, beads, and laughter. Spring break and St. Patrick's Day was celebrated with a variety of programs, live music, and green beer. The warm weather during the second week of April had our maintenance departments setting up some outdoor furniture to allow many residents to have some fresh air and some warm sunshine. The Grand Pal program and the Companion Calls program have been implemented at Rockwood and at Lee Manor to connect the residents with students through letters, that's the Grand Pal program, and Zoom, which is university students. Each form of communication gives both the residents and students the opportunity to share their life stories, interests, and passions. These programs are a great intergenerational experience for the residents and the students, and color it for our residents through our community partnerships. And that's the end of my report.
Thank you. Any questions for Shannon? All right, I think that concludes that report, doesn't it, Karen? Can I have, I guess we'll call a question. All in favor of receiving the report? That is carried. Thank you. There is no closed meeting matters today, no correspondence. Is there any other business from any members? Not seeing any. Our next meeting date is scheduled for July the 11th, 2023 at 9 a.m. And I believe, Sarah, you said all of our long-term care committee of management are going to be virtual, right?
Through you, Mr. Chair, yes, that is my understanding at this time. They will remain virtual for the foreseeable future.
Okay, thank you. All right, if there's nothing else, I know Warden Millen wants to get out onto the land, so I'll take a motion to adjourn. Moved by Warden Millen, seconded by Councillor Nielsen. Thank you, everyone, for your participation and attendance today. We are now adjourned.
Thank you all. Have a good day.
Take care.
Thank
Bye-bye.
you.
Bye.